A very good afternoon to our distinguished chief guest, all the faculty members, parents, and my fellow students. I am Nikita Sharma, pursuing second year Bachelor of Commerce. Guru Shri Shanti Vijay Jain College for Women deems it as a privilege in organizing the state level awareness webinar on the theme Vaccination, hosted by the Gssjc-Youth Red Cross Unit. You can't enjoy wealth if you are not in good health. On behalf of our college and Youth Red Cross Unit, I feel extremely glad to render a hearty welcome to you all. Prayer should always be our first response to every situation. Let us commence this informative and beneficial session by seeking the Almighty blessings. A warm welcome makes an occasion more special. May I request Dr. Vishalachi ma'am, coordinator of GSS Youth Red Cross Unit, to render a gracious welcome to you all and read the credentials of our prominent chief guest.
Thank you, Nikita. Good afternoon to one and all present here. It's my pleasure to extend a cheerful welcome to all. First of all, I would like to thank each one of you for joining this state-level awareness webinar on vaccination, a life-saving tool. It is organized by GSS Youth Red Cross Unit in association with Westminster Hospital, Chennai. It is a glorious moment to extend a warm welcome to our eminent guest of honor, Dr. Mansi Verma, Consultant Obstetrician, Gynecology and Laparoscopic Surgery, Westminster Hospital, Nandapakam, Chennai. Dr. P. Subhashini, Consultant Lab, Westminster Hospital, Chennai. Hearty welcome to you, ma'am.
Thank you, ma'am.
Yeah, ma'am. Thank you, ma'am. It is my immense pleasure to extend a hearty welcome to our wonderful program officer and the secretary. It is my duty to welcome our fellow faculty members and beloved students. Now it is a time to introduce our renowned guest of the day. I'm greatly delighted to take this opportunity to introduce our guest of honor, Dr. Mansi Verma. Dr. Mansi Verma, MBBS, MS, OBG, DNG, Diploma in Laparoscopy, Consultant Obstetrics, Gynecology, and Laparoscopic Surgery.
And read the credentials of our prominent chief guest.
She has an experience of 9 years in her field and has been actively involved in academics with a lot of national and international publications under her name. Has been working with Bloom Life Hospital for past 2 years with her expertise in high risk of obstetrics, fertility, and laparoscopic surgery.
Ma'am, I'm sorry, I'm not able to hear you actually. I'm not able to hear you. You're not audible, ma'am, actually.
She is a strong advocate of women's health and has always
I think
participated
the volume is
in
lesser.
fighting young men for a better future.
I can hear Mansi, ma'am, but selection.
Ma'am, volume is less, I think. It is audible, but the volume is very low, I think. That's why we can't hear it.
Yes, okay. Uh, Now it is time to introduce another guest, Dr. Subhashini Selvinar, Westminster Hospital, Chennai. She has completed her MD Pathology. Dr. D. Subhashini is an advocate professor in a medical college and has a rich experience in the field of laboratory for 7 years. Madam has participated in research programs.
Ma'am, we are sorry for the technical error. We'll be there within a minute.
Sure, sure, Nikita. Thank you. But ഇത് വെക്കാൻ വയ്യാട്ടോ.
It again it went.
Sorry for the inconvenience. Good afternoon to one and all present here. It's my pleasure to extend a cheerful welcome to you all. First of all, I would like to thank each one of you for joining this state level awareness webinar on vaccination, a life saving tool, which is organized by Gssjc-Youth Red Cross Unit in association with Westminster Hospital, Chennai. It is a glorious moment to extend a warm welcome to our eminent guest of honor, Dr. Mansi Verma, consultant obstetrics, gynecology and laparoscopic surgery, Westminster Hospital, Nungambakam, Chennai, and Dr. P. Subhashini, consultant lab, Westminster Hospital, Chennai. Party welcome for both of you, ma'am.
Thank you so much, ma'am. Thank you.
It is my immense
Thank you, ma'am.
pleasure. Welcome to our Honorable Secretary, sir, and respected Principal, madam. It is my duty to welcome our fellow faculty members and beloved students. Now it's a time to introduce our renowned guest of the day. I'm greatly delighted to take this opportunity to introduce our guest of honor, Dr. Mansi Verma. Dr. Mansi Verma, MBBS, MS, OBG, DNB, Diploma in Laparoscopy, Consultant Obstetrics, Gynecology and Laparoscopic Surgery, Westminster Hospital, Nungambakam, Chennai. She has an experience of 9 years in her field and has been actively involved in academic with a lot of national and international publications under her name. Has been working with Bloom Life Hospital for past 2 years with her expertising in high-risk obstetrics, infertility and laparoscopic surgery. She is a strong advocate of women's health and has always actively participated in educating and nurturing young minds for a better future. Now it's time to introduce another guest, Dr. P. Subhashini, Consultant Lab, Westminster Hospital, Chennai. She has completed her MD in pathology. Dr. P. Subhashini is an associate professor in a medical college and has a rich experience in the field of laboratory for 7 years. Madam has participated in research programs and published 15 research papers in international journals and presented various papers in international conferences. She has the experience of technical manager in a NABL accredited lab. She has undergone quality manager training for hematology and has acquired her diploma in counseling and stress management with distinction. I thank Dr. Mansi Verma and P. Subhashini Madam for accepting our invitation to be the guest speakers for this life-saving awareness session, vaccination. Once again, I welcome you, ma'am, and thank you very much. Thank you.
Thank you, ma'am. So I think Dr. Subhashini, we can start, right?
Sure, ma'am. Waiting
Yes.
to.
Yes. Hi, Nikita. Should we start or?
Yes, ma'am. Thank you, ma'am, for your welcomings. It is time to acquire knowledge. May I take the pleasure of requesting our guest of honor, Dr. Mansi Verma, ma'am, to take over the session.
Okay, thank you so much, Nikita. I think it's wonderful to be here with all of you and with all the women and girls of Jen's College. And it gives me immense pleasure to talk on something which I'm very passionate about, whether it's your cancer prevention, vaccination. It really gives me a power or a tool to basically educate everyone. So before we dive down into vaccination, I think as a gynecologist, I really wanted to talk about something which is very important and imperative in today's time and world, and that is regarding cancer prevention. And through that, we ultimately lead to vaccination also. If we talk about cancer in India and we talk about cancer in females, we have we know that amongst all the type of cancers, breast cancer forms the most common type of cancer which is seen in women, followed by cervical, followed by your oral cancer, followed by ovarian cancer, followed by uterine cancer. So I really wanted to bring light onto this topic through because I wanted to make you all aware about what are the symptoms which can be there and how you can prevent it as early as possible. And vaccination forms again a very important part of that prevention. So just to talk about brief points about these cancer, like just the important things and what take home messages I would want to give to all of you. So let's start with the first, breast cancer. As I told you, it's the most common cancer which is seen in our country. in women, and most common reason why a lot of women lose their life. Almost 27% of cancer all over, which happens in women, breast cancer forms the bulk of it. It is seen both in rural India as well as in urban India. Almost every 4 minutes, one woman is diagnosed with breast cancer, and it has a post cancer survival rate of 60%. So if we diagnose it early, we understand about it early, we have self awareness, we do screening for that, automatically it is easy for us to catch at a very earlier stage and automatically increase the survival rate. Amongst all our states, Kerala has the highest cancer rate, and I think Chennai itself forms as a third or the fourth state where we see a lot of women suffering from breast cancer. Commonly, it is seen in a younger. It can be seen in the younger age group. From the age of 30 to 50, we see women coming up with complaints of lump or discharge from breast, and when we know that these are the precursor of cancer symptoms, which we usually pick up in women, and but it can also be seen in as late as 50, 60 years also. Now, if I talk about the risk factors, we know that there are something called modifiable risk factors, something called unmodifiable risk factors. When I talk about modifiable risk factors, those which we can change. So definitely your weight, being overweight is a very, very, very important risk factor. And these days we are seeing obesity on a higher rise, and we know that the girls with childhood obesity and all, they have more of estrogen hormone in their body, and that's why they are at an increased risk of having breast cancer later in life. Not being physically active, again related to obesity. Having smoking, alcohol, these itself increase as a risk factor for putting you at any form of cancer in the body, because they cause damage to your cells. Not having children, not breastfeeding, on being on oral contraceptive pills for a very long time, like a period of 5 years, 10 years, then it increases the risk of breast cancer. Using hormonal therapy and using breast implants. So these are commonly the modifiable risk factors. The unmodifiable risk factors which exist and which we can't change. So it's basically our genetics. So if you have hereditary risk factors like your parents or grandparents, that there is a history of cancer in the family, or sometimes there are genetic mutations which are commonly known like BRCA1, BRCA2, again which are associated with your breast cancer. Being born as a female itself puts you at a risk of having breast cancer. As the age increases, again it increases at the risk of having breast cancer. Race, ethnicity, earlier it was seen that white women or women of Caucasian descent used to have a higher risk factor, but these days we are seeing in our country also the risk is increasing. Having early periods, when you get your periods at an early age and when you get menopause at a later age, that also, the longer the duration you have your bleeding or your menses, it again increases the risk of getting your breast cancer, because more hormonal exposure happens to your breast tissue. So these are the risk factors which you should be aware of. Some things are in our hand, some things are not in our hand, but those things which are in our hand, which I mentioned, the modifiable ones, we should take care. Common symptoms which you should be aware of are like your change in your nipple structure, change in your breast shape, size. Sometimes you feel a lump or a mass. Sometimes you see a discharge. So if you see any of these abnormal changes, you should definitely get it checked. You should definitely report it to your doctor, and a gynecologist or sometimes a surgeon might be needed for the first evaluation. And the most important part of screening, which I basically want to stress upon, is self breast examination. That is something which you all must know. There are no vaccine available right now to prevent breast cancer, but we know early detection, early awareness, and early diagnosis makes you prevent this condition, or makes you recognize this condition at a sooner rate and prevent morbidity or a like a difficult survival period. It makes it shorter. So automatically your number of life years increases if you diagnose it at an earlier time and you identify it and get the necessary treatment at an earlier stage. So self breast examination is something which I really want to talk about, which each and every girl should know. You should always check your breast. It includes both your visual as well as palpation or manual touching examination. Every month, each and every girl, women, they should check their breast. So it is done once a month, every month. So that should be the protocol. Once a month, every month, you should check your breast. And it is always important to notice any kind of change, any kind of lump or swelling in your breast. For girls who get menstrual cycles, it is always regular menstrual cycles. It is always better to check your breast after the cycle is over. For women who have already have had menopause and they don't have menses anymore, you should fix a date in a month in a calendar, like okay, every 10th I'm going to check my breast once. So this way it's easier and early, better for you to pick up any kind of breast changes, whether it is in your nipple area, whether it is in that black area which you see around the nipple, or whether in your entire breast tissue. So it just takes few minutes, and you can be ideally say while having bath, while taking a shower, or while changing your clothes in the morning or in the night, while lying down in the bed in the night, just once, always check your breast once a month, right? So that is very important. I'll just tell you few one or two quick points which you should know for breast examination, which is very important. So number one, as I said, visual inspection. So always stand in front of the mirror, just check your breast, the size, shape. It's not necessary that the two breast, they may have the same size or shape, they can be different. One can be larger than the other, but if that has been the pattern for you always, that is normal. But if you see sudden change in the breast size which was not seen before, or like you see any kind of changes in the shape of the breast, or the nipple changing, if the nipple is becoming retracted, any of these things if you notice, it is always better to note these changes and get a doctor's advice. So first is your visual inspection. So keep your hand on the side of your body, see, check your breast, keep your hand above your head, check your breast, keep your hand on your waist, flex your chest muscles, check your breast. So these three things are important. Second thing is your palpation. So palpation is when you press your breast and see, can I feel any lump, can I feel any mass? That is equally important. So always use these three middle finger and the index finger and the finger next to it, the pad of this area, that should be used to check or palpate any kind of swelling which you can feel, any kind of lump you can feel. Always squeeze your nipple to check any kind of discharge is coming from the nipple. If you see any kind of discharge, whether bloody discharge or watery discharge or milky discharge, you should not get it. So you should definitely get it checked from your gynecologist, which is important. So palpation is something which is a must. So after visual inspection, it comes a palpation, which you should palpate your breast and check. So palpation in the standing position or lying down. So when you lie down, automatically the breast tissue spreads out. It is more easier, evenly possible to check your breast. Always check it in circular motion so that you don't miss any lump. Always check that black areola, we call it the areola, the black area which is around your nipple. And always, as I said, squeeze your nipple and check for any kind of discharge. So if these basic self examination if you do, you will definitely recognize these changes. And you should teach to your mom, to your grandmother. It is very important, as I told you. Breast cancer itself, it forms a very important bulk of cancer in female, and it is important for us to recognize it as early as possible. So that goes for your breast cancer. And for people who have a family history, when you have a person in your family like your mother or grandmother who have history of breast cancer, always after the age of 40, they do a annual checkup in the form of mammography. So mammography is a test in which we basically scan your both the breast and look for any changes in the breast tissue or any kind of breast swelling or any kind of breast lump. So that's about breast cancer. Coming to the second most common cancer, which is seen in India after breast cancer, is your cervical cancer. And that's where the role of vaccination is very important. And I really want to stress for young girls how imperative or how important it is to get vaccinated. Like you get your vaccine for polio, you get your vaccine for tuberculosis, you get your vaccine for chicken pox. Similarly, vaccine is available for your cervical cancer prevention, and it is the need of the hour because cervical cancer is a preventable cancer. So when I say preventable cancer, it means we can prevent it. So as per, if I talk about the statistics, 22% of the cancer all over our country, which is seen in women, that bulk is formed by cervical cancer. It is commonly seen between the age group of 35 to 44. Of course, it is more commonly seen in the rural age group than the rural area than in the urban area because of lack of awareness again, lack of health, poor nutrition, and multiple childbirth. I will be talking about what are the risk factors which can cause lead up to cervical cancer, but we have seen that rural area or rural women are more commonly affected than urban women. India itself forms the highest cervical cancer burden all over the world. So it's like basically every one like that woman dies every 8 minutes. So there's a woman all over our country every 8 minutes who's dying of cervical cancer. So you know how severe is the impact. and it is a preventable cancer. We can correct it. So as for if I talk about vaccination, which I and Dr. Subhashini will be discussing, it has been said that if you keep vaccinating by 2079, India can may eliminate cervical cancer from our country. So that is possible, but it's just a lack of awareness and lack of sometimes availability of resources, because of which our vaccination is not as much as it is supposed to be. And now coming to the risk factors, as I was mentioning, what can lead to cervical cancer. So definitely early sexual contact. If you get sexually active at an earlier age, like 16 and all, which we usually see in like rural area, because if there's child marriage or early marriage, the sexual activity starts faster. These days, we know that in urban area also girls are sexually active. It is irrespective whether married or not married. So if you are sexually active before the age of 16, vaccine is for you. You have to get vaccinated so that you get protected from it. Second thing is, if you have multiple sexual partners, again it puts you at the risk of cancer. If you do cigarette smoking or there is tobacco chewing, it again puts you at a risk of cervical cancer. Associated infections like HIV, AIDS, this again brings down your immunity. Lower immunity, poor nutrition, poor hygiene. So these are all common risk factors which we see which can lead to cervical cancer. And the last but the most important one is something which I don't know if you all are aware or not, something called HPV virus. So it's called human papilloma virus, which is most commonly, like in 70 to 80% of cases of cancer, this is the one which is associated and responsible for causing cancer in women. So if I say almost 80% of women by the age of 50, they come in contact with this virus. So it's a sexually transmitted virus. It gets transmitted because of coming in contact with mucous membrane, your genital skin, while intercourse, while oral sex. That's how you come in contact with this virus. And your body is capable of fighting off this infection only when I mentioned those risk factors like poor nutrition or poor hygiene, or when you have multiple sexual partners, or these are the reasons why your body is not able to fight off this infection. And if this infection persists, which happens over a period of 5 to 10 years, that's when you are at a higher risk of getting cervical cancer. So definitely, when we talk about this virus, we know that, as I said, 80% of women will get exposed to this. Your body is capable of fighting off this infection and having your immunity of your own. It's not that if you get a virus once, you will definitely get cancer. It's not like that. Your body fights off the infection and you don't get your body treats it away. But only if this virus persists for a very long time, then you are at a high risk. And this virus has multiple subtypes. There are multiple variants of this virus which is there. The common variant is 611, which causes benign like genital warts, like your anal warts. So these are the ones which are which is the benign condition. Benign means which are not cancerous. And the cancer inducing variants are 16, 18, 33, 31, against which vaccine is available. So I'm sure Dr. Subhashini will stress upon that. So we have two variants of vaccine which is available in our country, and how it is given, what is the protocol, we will discuss about that. And when if you put this vaccine, which is commonly given from the age of 9 in our country, you can give, it protects you from the virus infection, and it protects you from the cancer changes which this virus can cause. So it is very important for you to understand the significance. And it's not, unfortunately, cervical cancer vaccine is not incorporated in our national program, and that there is a lack of awareness, and that's the reason why we are talking today, because we want to stress it and want to make it a point that you all should be aware of it. You all should get vaccinated. And it's not that only it is said, and I think there is a common misconception that, oh, if you're not sexually active, only then you can take a vaccine. That's absolutely not right. Yes, if you are not sexually active and you take the vaccine before, like in young girls, like 9 years, 10 years, 11 years, the effect of vaccine is maximum. But it doesn't mean that even if you're sexually active, in fact, even after delivery, if you have delivered a child also, you can still get vaccinated, because it still protects you from getting high risk variants of the virus. As I said, there are multiple variants there, so it is always better to get vaccinated so that you protect yourself from this cancer. Apart from that, if I talk about screening, which is again very important, so I said vaccination is important, but the other thing which I really want to stress, which again young girls, I don't know if how many of you are aware of it or how many of you are not aware of it, is your pap test. So pap smear is something which is again very important and imperative. It has to be done. It has to be again incorporated in your health checkup, in your routine gynecological checkup. It's not necessary that you have to go to a doctor only when you have a problem. You should focus on preventive health. You should talk about amongst yourselves that, have you got your pap smear done? It's because it is very important for you to identify or know that if your cervix has an infection. So when I talk about pap test, it's just a 5 minute test which is done. We basically take a swab of your cervix. So cervix being the mouth of the uterus which projects into the vagina, and it is just like a cotton. Like how you clean your ears. It's like cleaning the cervix. The cells which we collect, we send it for testing. So pap smear, ideally, it is done between 21 to 30, 21 to 65 years of age. So you should start getting done pap smear between 21 to 65 years. It is done once in 3 years. So if your test is negative, if your pap smear comes that there are no cancer cells, your cervix is healthy, just get it done once in 3 years, because it basically helps in strengthening and catching if any early cancer cells are there. So the point about doing pap smear is that you catch any early infection or you catch any early cells which are cancerous or which are looking not healthy, so that you can get the treatment early. So three things which are very important in cervical cancer prevention is: one, your vaccination; second, your pap test, which you should do once in 3 years. You should get your pap test done; and third, your treatment, early treatment of if any of these abnormal cells are detected. So if these three things are done, we can eradicate cervical cancer. So there is a possibility of removing cervical cancer altogether. So if you want to take one point out of this, please get vaccinated and please get your pap test done. So that's the second cancer which I really wanted to talk about, and I wanted to this to get infiltrated in, and kind of touch upon this point, so that you all understand you and you all know about the significance of cervical cancer vaccine. Apart from that, if I talk about last, your uterine cancer, your endometrial cancer, that's another reason why I wanted to bring this cancer. So it is a cancer which was earlier thought that only Western countries have, or only Western women had, because of the kind of diet they used to have and obesity. But because again India itself is becoming a diabetic capital, India obesity is rampant. We see a lot of young girls who are obese, and one more common problem which we see is PCOS. So polycystic ovaries or polycystic ovarian syndrome. I am sure a lot of young girls would have heard about it. They might be suffering from it. These are the precursor conditions why you lead on to something called uterine cancer, and it is increasing. So it is again very important for you to understand what are the risk factors, how you can prevent it, and how you can early diagnose this condition. So as I said, risk factors being diabetes, obesity, high BP, again getting your periods early, having your periods stop your periods stopping very late, so like you are having your menstrual cycle period for a very long time, puts you at a higher risk of getting exposed to estrogen hormone, which is the precursor of changing the uterus inner lining. We call it endometrium, and that's why the thicker the endometrium becomes, the more proliferative it becomes, the more chances of having cancer changes in that endometrium, and it comes because of all these risk factors. So when you don't nulliparity meaning if you don't have babies, it again puts you at a high risk. Apart from that, excessive exposure to hormones. So if you have excessive exposure to estrogen hormone, it can again put. Oral contraceptive pills in this case is protective. It protects you because it doesn't let your body have very high amount of estrogen exposure. So in that sense, oral contraceptive is protective for uterine cancer, which you should know. And last risk factor which I mentioned is PCOS. So a lot of young girls are getting PCOS these days. As I said, your insulin resistance is peaking, diabetes is peaking, and because of this high PCOS number, or like it's almost like one every year 1 million girls are added in that PCOS category. The irregularity, the stress, the abnormal cycle pattern, this all is making you more prone to have a larger amount of estrogen exposure in your body, again putting you at a higher risk of cancer, not right now, but in future. So if you're aware about it, you correct these risk factors, automatically you prevent yourself for having these kind of abnormalities in later. So have if we talk about symptoms, having abnormal period pattern, irregular period pattern, and most commonly having bleeding after menopause. So once menopause happens, if you have bleeding after that, that's not right. You need to get it evaluated, you need to get it investigated. Sometimes pap test, which I just mentioned for cervical cancer, that also picks up abnormal cells from your uterus, which can let us know or early diagnose your endometrial cancer. Or having pain in your lower abdomen, or having bleeding in between your periods. So these all could be the signs which you should note, which you should know. We don't see uterine cancer in a younger age group. It is less common between 30 to 40. We see more commonly in 50 to 60 age group. But the risk factors, if you know now, you will be able to act on them and prevent yourself for landing up in the category of getting endometrial cancer. And last but not the least, if we talk about screening, how to screen for your uterine cancers and able to understand how we can pick up those points. So pelvic examination, always get yourself checked. As I said, preventive health is most important. You should get yourself checked once a year. A gynecologist can check you, should note your uterus size, note your uterus inner lining thickness, doing ultrasound. So ultrasound is a very nice, very good modality, in fact, to pick up any kind of changes. And it is more helpful for women who after menopause, because it tells any kind of changes which is there in your uterine thickness. If it is becoming more thicker, we can pick up any kind of changes earlier. Sometimes you might have to end up taking a biopsy. Sometimes we do surgical cleaning of the uterus. We call it DNC, which helps in picking up. And last, like CT, MRI are done. But for you people, what I basically want to focus on, risk factors. You need to modify these risk factors at an early age. Have a healthy eating lifestyle, do physical activity, avoid obesity and overweight. If you have irregular cycles, please get yourself diagnosed that why do you have irregular cycles. If you're suffering from PCOS, get yourself treated. Make sure that you are kind of implying corrective lifestyle and diet changes. I know because of the stress, because of your kind of lifestyle what we lead, we are mostly sedentary. All these risk factors increase, and it is just pushing our society more and more towards the diabetic burden and cancer burden. And that is why it is very important for us to bring these preventive changes in our lifestyle and diet. And definitely one of the most preventive thing is vaccination. So that's why for everyone, we are going to stress upon cervical cancer vaccine, which is, as I said, it's important and need of the hour. And I would now like to ask Dr. Subhashini to speak on that and give you more input. Thank you. Dr. Subhashini? Dr. Subhashini? Nikita, can you add Dr. Subhashini, please?
Thank you, ma'am, for your valuable and informative address. Vaccines are one of our most important tools for preventing outbreaks and keeping the world safe. While most children today are being vaccinated, far too many are left behind. To make it even more efficient, now I secondly call upon Dr. Subhashini ma'am to take over the session and make it even more effective.
Good afternoon, one and all. I'm Dr. Subhashni, Consultant Lab, Westminster Hospital. Mansi ma'am, first I want to thank you for such a highlights on each and every category of female malignancies and your highlights on all the preventive measures also. So as we all know, prevention is the step for a society which is more healthier. I am going to have kept my agenda for the talk only on the basis of vaccinations and especially adult vaccinations. Why immune response as vaccine is necessary for an adult? What are the barriers which is preventing us from taking the vaccine, and how we are going to address these barriers? And how are you going to identify the patients or the people who need vaccines? And I have some of my colleagues here who would make it a little more interactive for us by few questions. So, moving on to the agenda, why we need vaccines as adult. We all know, we all think that as we grow up, the need for vaccine is less, but the protocol or the agenda is totally not right. What happens as a child less than 12 years, we have something called thymus and tonsil, which keeps producing the antibodies in a proper level in our body. So these antibodies are the major soldiers of our body. They keep protecting us as soon as an infection enters. So the longevity of the infection to grow in the body is less in a child. That is why we say that chicken pox, which comes in younger age, is safer than when it comes in an adult. Or even the COVID, because of the thymus and tonsil respond antibodies, the effect on a kid was lesser when compared to an adult. So as we grow up, the function of the thymus and tonsil keeps decreasing. So what happens when we get an infection, it has a longer time to multiply in our body before the antibodies are produced, and hence the severity and the complication of a infection is increased. So this is the need for certain vaccines. Why? Because the vaccines, when taken for particular disease, for example, we are taking vaccine for infection called for chicken pox or hepatitis, the corresponding the antibodies for that infection is already ready in your body. So when you get the disease, the antibodies fight against that infection, and hence the multiplication and the infectious duration is less. And one more thing, the susceptibility for us is also more. For example, we go for work, we meet thousands of people, and after age we are exposed to other type of sexual contact, etc., so which makes us more and more susceptible for a particular disease. Thirdly, economy. When we take a vaccine, definitely your duration to not go to school or not go to work is decreased. So finally, your financial economy is not affected because of having an healthier society. These are the criterias which has to be notified for adult vaccination, because still adult vaccination is a dark area. We are hesitant to take vaccines, or we feel that why do I have to take vaccines, or there are certain norms available or certain wrong guidance available which says that vaccines are not necessary. Finally, we are afraid that for that one day fever, I'll have fever for one day or 2 days, I might not go to work, so I don't want a vaccine. So these are all highly wrong barriers. And finally comes the financial burden. We think that vaccines are expensive and we cannot afford for a vaccine, or not necessary for to spend for a vaccine, because vaccines are available in all forms, easily also available. So please lose the hesitancy, take certain vaccines. So what are the adult vaccines which as per protocol is necessary for the society right now? First and foremost will be the flu vaccines. So flu vaccine, if we are going to emphasize on, we have an agenda that I took swine flu vaccine. Why should I take another vaccine? I took another flu vaccine. Why should I have another shot? No, this is not the criteria. Flu keeps on changing its protein content. So when the protein content keeps changing, for every year, it is mandatory for us to take a flu vaccine, especially people who are diabetic, asthmatic, or even who are having other illness like liver diseases and all. These flu vaccines can prevent a lot of lung complications. So each year taking a flu shot will prevent the severity of the conditions caused due to flu virus. And secondly will be our pneumococcal vaccines. So what are pneumococcal vaccines basically are? Now the pneumococcal vaccines have become a mandatory in kids. After 2008, the pneumococcal vaccines are mandatory in our chart. But in adults, before 2008, most of us have not taken the pneumococcal shots. This pneumococcal is again a very important vaccine for especially for people who have certain neuro CSF leaks or certain exposed to certain meningococcal infections, CNS that is which affects the brain. Those infections can be prevented if you are taking pneumococcal vaccine. And thirdly will be our tetanus toxoid vaccine, TT vaccine. So what we have taken this TT in our before 6 years, it is a mandatory. But in adult, we forget to take our TT. As per the WHO criteria, TT vaccine is necessary to be taken if you are unexposed to any trauma, any accident, or any other bite or etc. You have to take TT vaccine every once in 10 years is the criteria right now. Because we might think this small injury, why should I take a TT shot? No, it doesn't depend upon what type of injury. It depends upon the form of injury which you had undergone or certain rust or something which has entered your body, and it might cause a lot of complications because tetanus toxoid can cause muscle spasm and make you even bedridden for and also it is highly fatal. So TT vaccines are very important. Moving on will be our hepatitis vaccines. So hepatitis, why is hepatitis very dangerous? Hepatitis, what is the most irritating part or what is the most dangerous part of hepatitis? So this virus can affect the liver cells directly. And the most bad thing is there is no proper medicines which can repair the damaged part of the liver. Once the hepatitis has attacked your liver, the hepatic cells or the liver cells are damaged. It cannot be repaired. They can just be covered with some fiber material, but it cannot be repaired. Once the cells are lost. The treatment can produce new hepatic cells, but still the disease is highly endpoint. That is, it gets chronic. The illness is never cured completely. So prevention from hepatitis is very, very, very important, especially who all are exposed to health. For example, you might be having people working in hospitals, nurses, IMRs, doctors, or who are having their spouse who are working in healthcare. See, as women, we are facing a lot of people in our family, and educating each female is like educating the family. So we have to emphasize the role of these hepatitis vaccine to our neighbors and tell them to take a blood test and see the titers, how much hepatitis antibodies they are having in their body, and to take the vaccine. Once the liver cells gets damaged, you cannot say whether I will get or I will not get. So there has to be an emphasis given to this hepatitis infection because there is no proper complete recovery from that illness. And I want to move on and emphasis about the herpes infection or the varicella infection. What happens if this varicella or herpes happen in an adult? We all have heard about chicken pox, and we all say that herpes infection which comes in our face and all small lesions. So what happens once you have got this infection? They go and stay in your nerves, and they can get reactivated at any time. So this to prevent this reactivation and to make these herpes infection totally dormant, we have to take this varicella or herpes injection Gssjc vaccine. We call it as we have to take it at proper intervals of at least after 40 years. It has to be taken at least in 2 shots. We have to give the injections. And finally, moving on is our latest human papilloma virus or HPV virus. Only vaccine which is available to prevent cancer. See, cancer, how to prevent cancer? Ways to prevent cancer is a growing quest for all of us. So when we have a vaccine for it, why not we take it? We have to take it, especially females less than 14 years. That is 9 to 14 years is highly ideal to give a HPV vaccine. And if it is given within 14 years, it is only two doses, first dose, an interval of 6 months, the second dose. But after 14 years, up to 45 years, you can have to give it as three dose, first dose, then 1 to 2 months, the second dose, and after 6 months, third dose. So these are the normal adult vaccines and the importance of these vaccines. So who all require vaccines as such? Or as I emphasized, hepatitis is very much necessary for people working in healthcare, those who are traveling abroad, and also those who are immunocompromised, for example, certain diseases which will affect their immunity. Moving on to flu vaccines, we now the recommendation is every adult is vaccinated for flu is a criteria of norm. Shigella vaccines or the herpes vaccine is also important for all adults after 45 years, and HPV vaccines for all females less than 45 years have to be mandatorily taken their HPV vaccines. So now I have some of my colleagues who are having certain queries or they have questions to be asked regarding adult vaccination. We will move on to that question session. You will not be able to see them, but they are just sitting near me. I would repeat the question and give the answers for it. See, egg allergy or egg protein was one of the content for vaccine previously. For example, all the vaccines like MMR, DPT, diphtheria was one of the component was egg, and it was given previously. But now most of the vaccines are available as non-cultured media, that is recombinant techniques. So it is safe, but the point is it depends upon the allergy levels. Initially, milder people we can easily give. Those who have certain like one swelling or hive like that is they'll have dots in that. So for them it is has to be administered. The vaccine has to be administered, and a time of 20 minutes observation is very much necessary. And people with high anaphylactic shocks, they cannot be given vaccine as per our thing. They have to undergo a general physician opinion and then take the vaccine if absolutely necessary. Contraindicatory MMR vaccine is actually initially it was not given for people with egg allergies, but now the recombinant technique vaccine can be given for patients with egg allergy. Not only egg allergy, lot of allergic conditions. People feel that I'm allergic. Can I take a vaccine? Can I take? Definitely now the vaccines which are now available are safer to be taken under supervision of a medical practitioner. With an observation period, you can take vaccines. Yes. Yeah. So this was a common question which was asked because after COVID vaccine or after hepatitis vaccine, when I can undergo blood donation. So ideal is up to 4 weeks, but after 3 weeks also you can donate blood. So ideal time is you can wait for a month after your vaccine to give blood donation. Yes, HPV is an infection which affects both females and males. Usually, it affects but the consequence of malignancy in males are less. They develop only genital warts. But yes, HPV vaccines, which are available as 32 form, can be given for males. Yeah. So for flu vaccine, there are two forms. One is injectable and other is intranasal spray form. The best and available one is intranasal forms. Intranasal forms because they act in two mechanisms. One is they act a local immune response in the nasal passage, and injectable forms will act only in your blood. So highly preferable for flu vaccine is intranasal, and it is now available in market also. We can ask your physicians to prescribe intranasal for flu vaccines, which is very good. Efficacy is more. So immunocompromised like HIV patients, before vaccinating these people, we have to check their immune status, their lymphocyte count, and then it is usually not preferred. Apart from this, for example, if we are giving MMR vaccine, patients who have undergone muscle spasms, that is neuromuscular disorders, those who have certain Guillain-Barré syndrome, there are certain conditions which will paralyze the muscles of the chest and abdomen. So these people we are not prescribed to give vaccine at least for 4 weeks prior the disease. So we have to wait, and better also we can avoid in these conditions. Apart from this, all people can take adult vaccines. Yeah. So when we take HPV vaccine less than 14 years, it is more safe and more the efficacy for preventing infection and cancer is better, because the sexual contact less than 14 years is not usually not there. So when a female takes the vaccine before the first episode of the sexual contact, the efficacy is more, because the antibodies and the necessary preventive structures are already available in the cervix and vagina. So the girl is more safer and more protected by the HPV vaccines. Ma'am? Yes, ma'am. So, CA cervix, the pap smear test, as Mansi ma'am said, even after vaccination, regular pap smearing after age of 31 for once in 3 years is very much necessary, irrespective of your vaccine status. It has to be done. So, okay. Any more doubts? So, as I want to summarize my talk, vaccination in adult has to be the hesitancy to be removed, because vaccination will prevent the severity, complication, and the disease longevity. So, you are more healthier and more safer in the environment for yourself and for your family. So, thank you so much.
Thank you, ma'am, for your inspiring address on vaccination. Now I request the audience to type their queries. Participants, please type your queries in the live chat box. We have no questions from the participants, and hence we can proceed with the vote of thanks. Thankfulness is the best form of courtesy. On behalf of GSS Jain College for Women, I take this opportunity to propose the vote of thanks. I first thank the Almighty God, whose grace has made the state level awareness webinar successful. I express my heartfelt thanks to our guest of honor, Dr. Mansi Verma ma'am and Dr. Subhashini ma'am. Thank you, ma'am. We felt that it was highly beneficial to us. I extend my gratitude to our correspondent, Dr. Gautam P. Vaitsa, and our principal, Dr. M.K. Malati ma'am, for their guidance and support. I convey my heartfelt thanks to Dr. Visalachi ma'am, coordinator of Youth Red Cross Unit, for their effort in arranging this session. I also express my special thanks to all faculties who have joined us from GSS and institutions. I also convey my heartfelt thanks to all the parents for taking part. It is my duty to thank all my fellow students for their participation. Thank you all. Thank you once again.
Thank you, everyone. Thank you, Dr. Subbulakshmi. Thank you.
Thank you, ma'am. Thank you so much. Bye.